is Real People, Real Matters with Diana Tulchinsky. This is my first guest, Dr. Fatima Vilich.
Hello, and thank you very much for inviting me. It's my pleasure to be here.
I met you a couple months ago at the Park District at our Zumba class. It was very nice.
I love the dancing classes. They have wonderful groups.
Tell me, Fatima, how did you like Bosnia and your high school years in Europe?
I enjoyed it. It was very inspirational. I had a very inspirational teacher, Dušanka Jankelić, who really helped me, get interested in science. And I went to the science fair and won a first award doing some genetic research. So that was wonderful.
As a kid, what was your favorite winter and summer sports?
When I was a kid, I was diagnosed with scoliosis, mild scoliosis, and I went to gym and started doing gymnastics, and I became a champion in rhythmic gymnastics.
Wow.
And winter sports, we have lots of snow around Sarajevo, my hometown, so I did lots of skiing, and I still ski, and we did have a Winter Olympic Games in '84. So.
Oh, okay. How difficult was transitioning yourself from a physician in Europe to physician in the United States?
Well, I had became a physician twice. So first time in Bosnia was definitely easier because it was my language. Here I had to learn with a new language, but it was fine. When I came here 20 years ago, I passed the exams to become a physician in one summer, so that was pretty good, yeah. Very
good. What are the demands of the body working as a physician in a hospital?
Oh, demands are huge. After passing my exams, I did the residency at Northwestern University. I did anesthesia residency and did 1 year fellowship at Children's Memorial, fellowship in pediatric anesthesia. And there was lots of nights when you don't sleep 24 hours, sometimes every third night. So that is very hard, even though we are physicians and we teach, a lifestyle, very, very difficult lifestyle when you really don't eat right foods and just try keeping to be awake, and the stress is really huge. And when I became attending at Loyola University and became a director of the pediatric cardiac anesthesia, I was even more, in the hospital because I was, helping little babies have their congenital heart surgeries, which is a very responsible, job. So pretty much lived in a hospital. Not very easy when you cannot sleep, when you cannot eat, and exposure to toxins is huge.
Did you have any physical problems with your back, or?
I did, exactly. I developed actually severe back pain, and as much as I was getting lots of shots, steroid shots from my colleagues, anesthesiologists who specialize in pain relief, I was not getting better. And I found functional medicine. That was the only time when I actually was able to find out why I had the pain, and I got completely better.
What's the difference between functional medicine and conventional medicine?
The difference is that functional medicine basically looks to find out why you have a disease. It's trying to find out what's the root cause of a disease. And it does not treat symptoms like conventional medicine does. So I'll give you an example. If the patient has a depression, they are not sleeping, they don't want to get out of bed, they don't want to do anything, their sexual drive is low, it's a depression. They will get antidepressants. In functional medicine, we will try to find, again, the same question, why do they have that, problem? And they may be vitamin D deficient, and in that case, therapy is vitamin D. They may have mercury fillings or eat too much sushi, tuna with mercury, and they are intoxicated. That's the reason. So therapy is different, obviously. They may have insulin resistance, or they may have hypothyroid function, which will make them feel depressed. They may be taking too many antibiotics, and their gut flora is out of balance. So all of those are different issues, and they have to be treated accordingly.
What is the role of chronic inflammation and disease?
We have really epidemic of chronic diseases, and since the beginning of 18th century, when we introduced sugars, we have developed epidemic of chronic diseases, from diabetes, metabolic syndrome, to heart diseases, to cancer, to autoimmune diseases. And sugar is unfortunately a big culprit. What happens, we are basically making out of sugar, and the worst one is the fructose that is in all our sweetened drinks or processed foods, and that fructose, unfortunately, is metabolized in fats in our liver. So our liver becomes filled with triglycerides, and we cannot detoxify ourselves. So then we get more and more toxins, and that is the basis for development of the chronic disease. Whenever we eat sugars, our insulin goes really, really high, and 50% of the patients, of Americans, they have already insulin resistance. So insulin resistance is causing inflammation in our body. So we are inflamed, and that's the reason why we are having all of these chronic diseases.
And as a physiologist, do you deal with people without narcotics? I mean, do you prescribe medication without narcotics, or?
For pain, when someone has a pain, it's the same thing. I do not, yes, I want to help them, so they can have immediate pain relief, but also I want to know why they have a pain. And inflammation is a big one. They may be inflamed, let's say they may have bad flora in their gut, and when their microbiome is made out of bad bacteria that are like parasites, they're making lots of toxins. Those toxins from gram-negative bacteria called lipopolysaccharides, they can go in their joints, and they'll have pains. They may be allergic to gluten, meaning they may have a celiac disease, or they may have gluten sensitivity when they will make they'll make antibodies again to gluten, and these complexes will travel in their joints, and they'll have pain because of that. Lots of people will have just vitamin D deficiency, which will cause a pain. Lots of neurotransmitter issues, such as low serotonin, will be followed with the pain issues. So hypothyroidism, hormonal issues, eating not enough omega-3 acids and fatty acids, and unfortunately in our nutrition we get too many omega-6, which are pro-inflammatory, and these omega-6, they come from the oils that are like soy oil or corn oil. So they have more arachidonic acid, which is more inflammatory, and so the pain can be because of that. So as you can see, the pain is just a symptom that there is something wrong in our body. We may be just having lots of nutrients that we are deficient, and we need to give them back to the body, so the body will be able to heal itself.
What's the role of cholesterol in heart disease?
Cholesterol is very important for our body. Everything that we make in our body cholesterol is needed. We need to make our neurotransmitters from cholesterol. We make our hormones. Our sexual hormones are made out of cholesterol. So cholesterol is very important. What happens with cholesterol, because of sugars, because of standard American diet has lots of sugars, cholesterol becomes oxidized, becomes sticky, and in the vessels, it sticks to the vessels, and we make atheromatous plaques. So basically, it is not important, how much cholesterol we have. It's important how much oxidized cholesterol we have, and by changing our nutrition and eating less of sugars, less of carbohydrates, we actually help our cholesterol.
Is there genetic testing for heart disease?
There are genetic testing. Most of the reason for the heart disease is nutrition. So it is a lifestyle, what we eat. But also there are some genes that are important, like MTHFR gene, which is a gene that if we are deficient, we are not able to make active folate. And the patient who have a heart disease, who have heart disease history and have MTHFR, they would actually benefit from getting active folate. So that is a good test to do, because the solution is very easy. All they have to get to supplement with active folate and they'll feel better. So.
And do you have genetic testing in your site that has, if you're exposed to heart disease as a young patient or even as an older patient, do you deal with that?
Basically, heart disease depends on, as I said, on genetic SNP. Some of them are like ApoE3 or prothrombin or factor V. These are all tests that I do. If patient had, like their mother or father had a heart attack, then I want to find out whether they are going to be predisposed to the heart attacks and want to help them deal with that. So,
what is the importance of vitamins and supplements in the diet?
The vitamin supplements, they are very important. Unfortunately, standard American diet doesn't have enough of the vitamins. The soils are depleted. The pesticides that are in the food, they are actually chelating agents, so they bind those minerals. So even if we eat those foods, they don't have enough of the minerals. Also, if we cook our food, everything that is processed, we will lose the vitamins. So I find that we have, unfortunately, epidemics of the people who are overweight, but they are more, actually, they're deficient in their nutrients. So we live in a toxic world as well. So we get the toxins in our food, in our water, and the more toxins we have, we need more of the vitamins, because the vitamins in our metabolism, basically, they are like cofactors. What they do, they help enzymatic reaction progress, and without them, that cannot happen. So they're very important.
For Hashimoto and hyperthyroidism, do you deal with that with some medication, some monitoring? How do you deal with that?
We have epidemic of autoimmune diseases. In the last 2 decades, we have triple number of autoimmune diseases. Obviously, women, there we have like 24 million of women who have autoimmune diseases. And the main reason we have this epidemic is the level of the toxins in our environment. I mean, now if you test a newborn, they have 280 toxins in the umbilical cord at the date of their birth. So the toxins are a big reason for autoimmunity. I see lots of patients with Hashimoto, with multiple sclerosis, with sarcoidosis, IBS, diabetes type 1. But basically, that's the one disease. The body is making antibodies. So we are attacking our own tissues like a friendly fire. So it is very important what kind of toxins they have. So I look into that. I try to find out how is their gut and are they having leaky gut, because autoimmunity is proof to me that they have a leaky gut. So I look to find out why they have it so we can heal the gut. And they may have food allergies, so I test them for that.
Do you also treat fibromyalgia and migraines?
Absolutely. I actually have a lot of patients with fibromyalgia and migraines, and they're young people. They are aged from 30 to 40. I mean, and I feel badly for them because when I was sick, you know, I was losing hope because conventional medicine couldn't help me, and I feel bad for them because they are feeling the same. They are young, they are extremely tired, they have headaches, they cannot think, you know, they have pain in their muscles. So I find in their case that they have lots of issues with their mitochondria, which are the little powerhouses that make energy in every cell, and they can be tremendously affected by toxins. So these patients also may have some genetic SNPs. I try to help them. Basically, what they need is resuscitations of their mitochondria. 90% of the patients with fibromyalgia, they have a small intestinal bowel overgrowth. So in addition to the toxins that they get from environment, they also get the toxins, endotoxins from these bacteria. So I test for that and treat that.
With someone with celiac, though, what's the importance of testing, even if you're 20 or 50, with celiac disease?
Well, I'll tell you, there are like 1/3 of the American populations have gluten sensitivity. Celiac disease is basically that gluten is affecting colon. Gluten sensitivity is basically showing that gluten is able to get in the circulation through the leaky gut, and we make antibody against that, so we make immune complexes. So what happens is, like, we have developed lots of issues with the gluten, and 99% of people do not know that they are sensitive to gluten. And when we develop these complexes, they can go in our joints, they can go in our thyroid, we can feel depressed, we can also develop autoantibody against the thyroid because the gluten sequence is very similar to the thyroid tissue. So I have a 13-year-old child who is diagnosed with celiac, and in addition to that, she has severe leaky gut and lots of food allergies. And basically, the therapy is 100% withdrawal of gluten. She has to, whole life, she has to stay off it because it is toxic for her. And now we are trying to heal her gut to help her so she can in the future stop being allergic to cucumber and other, you know, dairy and other foods that she became allergic to. So it is very important to find out whether someone has a gluten sensitivity or celiac disease, because recently in JAMA they had a study that showed that those patients have increased actually mortality rate and increased incidence of heart disease.
What's the importance of testing for food allergies, especially in the family?
I think it's very important because this is what happens. If we develop leaky gut, which is, imagine just the gut is a lining, and imagine it's just punched holes, and then undigested food can go through those openings and be presented to immune system. And underneath that lining we have in our gut, we have 60% of our immune system is there. So what happens is, like, if we are stressed out and we're taking antibiotics or we're taking non-steroidals like ibuprofen, things such as that, we can develop this leaky gut. And then our immune system start constantly fighting foods. So the role of our immune system is to fight bacteria or viruses and be done with it. Now we are every day, every time we eat, you know, bagel, and then we have a pizza, or in the evening, you know, we have some dairy. We are constantly fighting the foods, and autoimmune system, our immune system is working in overdrive, and that will lead to the chronic diseases, and that will lead to autoimmune diseases, and that's the reason why we need to stop that.
And do you allow patients to lose weight, or how do you deal with that? From obesity, just even to overweight?
Functional medicine definitely can help with that because functional medicine is preventive medicine. The main reason people cannot lose their weight because they are inflamed.
Mm-hmm.
And by eating fructose, it completely stopped losing a fat, because we cannot burn fat if we eat the fructose, because body will use fructose as opposed to fat. The couple things that we need to do is avoid fructose and sugars and carbohydrates such as grains, because they all become sugars in our body. The other thing is like avoid the toxins, because the toxins are going to accumulate in our body, and fat cells go around the toxins to prevent toxins to go to the brain. So we need to stop eating food with the pesticides, use like non-toxic cleaning, solutions in a house, filter our water. So big thing is avoiding toxins, minimizing sugars, how to decrease inflammation, eat more anti-inflammatory foods, which is eat lots of green and colorful vegetables, because they are all anti-inflammatory, and fish, get the fish oil or eat some wild salmon to get healthy omega-3s, which are anti-inflammatory.
Why do you love your role as a functional medicine, even as anesthesiologist too? Why do you like that role?
I always loved healing people, and I always love helping them achieve their potential. I want them to feel optimal health. I want them to feel that they have lots of energy, that they are sharp, that they can think, that they can be smart and happy. And I feel that the functional medicine has become like the shiny beacon of hope for me and for my patients. As I graduated in '82, and I was doing conventional medicine, and I always had the questions like, how can I help my patients so they don't have side effects from the medications? And the functional medicine is the answer. So as a physician, I feel I'm in the right field now. And as a physician, I feel I have much bigger toolbox now that I can actually help patients.
Share some success stories for your patients.
Well, I think success is giving a hope, and lots of patients, they call me and they say, oh my God, I'm happy that I finally found you. So giving them hope and believe that they can heal. Successful stories. Recently I was seeing a young woman who came to me actually November 25th with rheumatoid arthritis and fibromyalgia, and being all tired and having lots of pain in her joints and not being able to think. And she went to Mayo Clinic and didn't get better and had the side effects from her medications. And a few days ago she came, and she looked like 10 years younger, and she had no pain in her joints. She got her energy back, and she told me she was looking for a job.
Wow, very good improvement.
Yeah, I was really happy for her. I was really happy for her. And I have other patients who I'm helping, who are feeling much better with Hashimoto. I have a patient who came with diabetes, and she was able basically just through the nutrition to get her sugar back to the normal level, and she lost 50 pounds in 3 months, and she got her energy back, and she's feeling great.
How far do your patients drive? What's like the farthest drive that you've ever seen?
Well, sometimes they drive 3 to 4 hours to come and see me. Yeah.
Wow. Yeah. And where can our viewers find you?
Well, I'm at the 2700 Patriot Boulevard in Glenview, and they can check my website, which is www.vibrant-health.info.
And what brought you to the Glenview location?
I've been living in Glenview area for last 20 years, so this is my home, so that's where I want to practice. I love it here. And
how do you enjoy your practice at the Glenview? Is it from being...
It's wonderful. It's my dream job. It's my dream job, and my patients are my extended family.
And do you have any endeavors for your family at all, or for your future career?
I always learn, so I never stop. So I always go to new conferences and try to learn some more, and I always try to help my family to, live healthier.
Thank you again, Dr. Fatima Vilich.
You're very welcome. It was my pleasure. Thank you for having me.
Thank you for watching Real People, Real Matters. This is Diana Tulchinsky with Dr. Fatima Vilich, Associate Professor of Anesthesiology and one of 250 certified medical functional practitioners. Thank you.